Good afternoon. My name is Mariah Peterson, and I will be presenting from the class Nursing 744 Practicum. So introduction. So my clinical site this term is at Heart of Hope, which is a clinic and urgent care combined. My preceptor currently is Matt Palmer. He's an ARNP. The patient population is pediatric to geriatric, and there have actually been quite a few pediatric patients, which I've been kind of surprised to see, which is good because I need more peds. Hours completed, 30 hours left to complete 82 roughly. Practicum experiences so far. So again, I'm seeing an increased variety of patients, including pediatric patients, which is a nice change from my last clinical site where I had pretty limited exposure to that population. Exposure to MCG, which is basically a magnetocardiograph, which uses electrical currents in the heart to detect any type of ischemic heart disease. And it's kind of been interesting to see this because it's a very new development in medicine, and it's the first time I've ever seen it. There's only one other in the Pacific Northwest that is used. And basically, it's a new form of technology that allows, again, one to identify ischemic heart disease essentially kind of before it starts. So it kind of replaces an echo, kind of replaces a stress test as well. So charting. So I've been charting a lot more in the EMR and on every patient, and the provider is reviewing all the charting. So that's actually been really helpful just to kind of get that skill solidified. And then exposure to minor surgical procedures within the urgent care, such as suture repairs, lipoma removals, things like that. So my SMART objectives, the first one was to have increased charting accuracy and efficiency, and I believe that this one is currently being met. Objective 2, I want to at least have one LAC repair from this practicum experience. I have not had that yet, but I was able to observe 2 lipomal removals, and that patient is going to come back. And he has 2 more on his legs, and he agreed to let me suture them, so I'm quite excited about that. Objective 3 is identifying otitis media in the pediatric patient. That one is still ongoing, just because obviously there is a higher volume of pediatric patients, but not all of them will let you look in their ears very easily, and so forth. So, objective 4, identifying skin conditions, just because I feel like skin conditions are kind of can be challenging just because they can be hard to identify, obviously. At this point, this objective is still ongoing, as I have not seen or the patients have not had a chief complaint of a skin issue. And objective 5, so the urgent care has their own x-ray machine, and to this point, the couple of days I've been there, we have not had to use that, but I'm hoping in the future that we'll get something in urgent care that will need a quick picture, and then I can work on my interpretation skills. So that one is also still ongoing. So again, currently the gaps are limited films, obviously, for interpretation, continuing to identify otitis media in pediatric patients, and I want to be really good at that skill, so I just have that in there. Probably an odd one, but continue to see patients in a timely manner and create a plan. That has been more of a challenge with this site because there are limited resources, because all of the patients are either cash pay or they buy into what is a membership program that the clinic/urgent care offers. So kind of working with that has been interesting, and it definitely makes you think more about your plan, what you actually truly need in terms of tests and diagnostics. So, and that is all I have. Thank you.